Hello and welcome back to the channel. My name is Dr. James Gill and you've joined me for a 25,000 subscriber Q&A video. I suppose the only thing that I can say is thank you. We've done a couple of these sort of little Q's and A's as we've grown over, shockingly to say, years, and to be honest, I find them entertaining to be able to cover the questions from you guys, but also it's just useful for me to think about how things are being portrayed. Now, at the moment, we are in probably one of the largest heat waves we'll ever have in the UK. And so any of you who are hoping to see Dakar join us in this video, probably going to be very unlikely. He's seeming to be spending the vast majority of the day lying around the house, stretching himself out and staying as far away from human beings and, well, any sources of heat as he can. And at the moment, that means that he's lounging around the camera bags in the room here. So I don't think he'll be visiting us. Over the last couple of years now, we've been dealing with the pandemic, and I think Abbie has really come through as a fantastic assistant with these videos, and that's one of the things that I've wanted to make sure we cover in this sort of little video. Yourselves have always asked questions of her, etc. So she's provided us some videos of her answering a few of the questions that you guys have put to her. So hopefully that'll give an interesting variation to what you're expecting here. Now, in terms of that, Abbie has recently graduated from Warwick Medical School and has now become a full doctor. So she's exceptionally pleased with herself, and I must confess I'm very proud in seeing her grow from a first-year medical student all the way through to Dr. Abbie Tutt. Now, I highlight that not just to big up Abbie, but the fact that she will still be staying involved in the channel, but we may be seeing her much less frequently because she's got her own work now as opposed to studies. But hopefully she will be doing her own parts of the channel. And again, we really want to try and stay with how can we help patients, how can we help students, how can we help people who are just interested in medicine, in these sort of breakout videos that we're doing, because more than anything, we've nearly finished all of the clinical skills videos. Now, I say nearly. Obviously, we restarted filming some of these during the lockdown, so we've got several where we're masked in them, and that prevents us talking about several things in terms of the mouth and the teeth and the dentition and all the various medical facts and medical signs that we miss with the masks on. So I am at the moment in the process of refilming a few of those without the masks, now that we've got the vaccines and we can try and make sure we're screening and keeping ourselves as safe as is possible. So I suppose this is where we should really do that whole Q&A thing. And let's stay with Abbie on that first question, because there was a very good question that came in, essentially about how did we meet. And so, Paniotis Savas, I'm really sorry if I'm going to mangle some of people's names and usernames on here. They have asked, I would really like to know how you and Abbie met, and please tell us some of the funny scenes behind that moment. Well, I'll let Abbie start off with that one for you.
So, first week of med school, we had a lecture with Dr. Gill and another clinical skills teacher. So that was the first time I had a lecture with him, but it wasn't till 2 weeks later that we actually had a clinical skills session together. And I started filming the videos because another of my classmates decided that they were too in revision mode to do the videos, so I got called in at the last second, and that's where it all began.
So there you have it. So essentially, Abbie wasn't even really... Abbie had the misfortune to be sat in the computer room as I ended up without somebody to film with. And the very first one that we did with Abbie was the clinical examination of the hands. And subsequently things sort of evolved from there. I feel that I've been very lucky to work with Abbie because she's very open about talking about her Asperger's and her journey as a medical student with a neuroatypical brain. And so it's been wonderful to work with somebody who, for want of a better phrase, gets it. And I hope that I've been able to help her with some of the strategies that I've put in place in terms of how I've learnt to manage my own brain in terms of clinical medicine and dealing with patients, and some of the things that happen in both hospital and general practice life that you can't predict. Okay, so what else have we got? Toasted asks, were you ever uncomfortable doing exams of more private areas, or is it something you're easy to get past? I know it's all medical, but I'm always uncomfortable when I have to get a physical. I think the important thing to remember there is that a patient comes to you in clinic and you have to take yourself out of the room. You don't matter for that consultation, and it doesn't matter whether or not what that patient has come in with affect you. You have to provide the best care you can to the patient at that time. And yes, part of that is going to be getting used to it. So a good example of that, when I was on the vascular surgery wards, often you'd see people with these horrendous necrotic ulcers, and the smell would be really quite pungent. I mean, I've dealt with a couple of patients who've had gas gangrene and have had to have their legs amputated, and honestly the smell caused me a headache. But that patient knows that they're in trouble. That patient knows that they have a problem. So seeing you as a doctor, screwing at your face or making, uncomfortable expressions really does not help them. So you have to remember that your facial expressions, your tone of voice, how you interact with that patient is actually going to have a huge impact on their acute care, as in the care that you're giving them at that precise moment in time. Because if you're calm, confident and collected, they're going to put their trust in you and they're going to be happier with you caring for them. Whereas if you're seeming unsure, unhappy and unwilling, then that's also going to have a huge impact on how they perceive your care and potentially worse outcomes for them. Remember, everything we do, it's focused on how can I help this person in front of me. So Jade has asked, what inspired you guys to become doctors? Love the videos, informative and relaxing. Honestly, I was on a science path and got bored of working in the labs. I love the science. I love learning how science and medicine could help people, but I didn't feel that I was actually doing anything to move people forwards. Now, I want to be very clear with that. That is false. That was my perception at that time. Now, one of the reasons why I highlight that so hurriedly is one of my friends who I was at Nottingham with, a fantastic individual, Dr. James Button. He has been a core scientist in creating some of the COVID vaccines that we have used. So I'm proud to say that I know a lab rat, as it were, who has that level of impact on the clinical health of patients of our country, heck, globally. So whilst I didn't want to stay in the labs, I have peers who have stayed in the lab and have done much more for people than I could ever hope to on a one-to-one basis as a doctor. Next question for Abbie. What inspired you to become a doctor?
So I don't really have a magical, I saw a doctor perform a procedure and that was it story. I wanted to become an astronaut, and then when I was 11, my science teacher wasn't very inspiring and I found that I didn't like the maths side of physics. So I decided that I'd become a doctor then, and it sort of stuck, and I just carried on the pathway, and it's not gone exactly how I planned at 11, but we got here eventually, and I'm glad that I have chased it for, what, 14 years now.
What's your least favourite procedure to do? I quite like surgery and even minor surgeries in GP, but anything that involves the dithermies, essentially cauterizing, I find that difficult because you've got this sort of unpleasant smell of, well, burnt bacon, and with it there's been discussions as to whether or not that gas formed when you're cutting through the flesh actually may be carcinogenic. So I'm always thinking about the airflow in the room and how much of the stuff that I'm breathing in. So on the one side, I love the technical aspect of surgery, but I dislike some of the things that my brain does whilst I'm doing it. Tajada Gulvers says, which medical topic interests you the most and why? I love gastroenterology. I think it's astonishing how we take things from the world, we take food, nutrition, fluids, and don't just take energy from that, but take the chemicals and form them part of our body. And similarly, how our food can affect our bodies and our mental health. So I have a lot of passion for that, as I do for diabetes for similar reasons. But it's something that often I don't get to practice much because, well, honestly, patients don't often like talking about food in that sense, partially because it's a very complex topic, and often, unless you're very careful with it, it can come over as if you're trying to change a patient in a paternalistic way, saying you should do this. So I love nutrition and gastroenterology, but I don't get to practice it as much as I'd like to. Part of that's also about timing. Yeah, part of that's definitely about timing. In a 10-minute GP consultation, you really don't have time to get into the nitty-gritty of how carbohydrate is going to affect your insulin, and on that how it's going to affect your glycogen, and how that'll affect your body's putting down of fats and things like that. It's an amazing field, but it takes time, and 10 minutes isn't really good enough, which is why a lot of those things we request the dietitians to help with, because they have more time for that. Does Abbie have a pet?
So I don't have any pets with me, which is quite sad, but at home I had 3 cats, a dog and a rabbit. We have actually owned up till 10 pets at one point, because one of my cats kept having kittens before we could have her neutered, so that was a fun couple of years. But yeah, I do miss my dog a lot.
Amanda Almeida asks, what's the most bizarre case you've ever encountered as a doctor? I was working in ITU and a patient came in through the A&E department because they'd clotted off a major artery to one of their limbs. Now, obviously I have to be careful talking about these things to make sure they're sufficiently anonymised. And that's quite a major thing, getting a blood clot in an artery, and it was putting his limb at risk. Now that clot was dealt with, and he stayed in ITU for a couple of days afterwards just to monitor and make sure that we didn't have any further issues, because the big question was, why is this fit, healthy individual had a horrific life-changing blood clot potentially? And we did all of the regular tests, and we did all of the irregular tests, so looking at weird things like JAK2 mutations that can hugely affect how people's blood clots and things like that. And we couldn't find anything. and this guy had no family history of any medical problems. You know, all of his family members are like, you know, hundreds of years old, you know, still running and cycling and things like that, all very, very fit. He's never had a problem. You know, very, very active guy. Used to compete in, you know, at sports, and swore blind that he'd never touched a drug in his life, never done anything like that. And we were thoroughly stumped. Now, sometimes these things can happen, but, you know, as in just, you know, idiopathic, something happens and we don't find a reason. However, one of the medical students we were with took a full history, and I mean complete, in-depth, even finding about his home. Was it a terraced house? Was it a detached house? Everything like that. And it turned out that the guy had clotted off, had this massive blood clot because he got high levels of red blood cells. And as I say, we'd done the test to find out why that was, and they'd all come back negative. Prior to the gentleman's admission to the hospital, there'd been building work done at his office and some new stuff installed. And something had gone wrong with that installation, and he had been affected by carbon monoxide over a long period of time. So he'd not really paid much attention to the headache because it passed, and he was getting such a low level that it wasn't affecting him significantly. But he was doing, you know, 10, 12, 14-hour days in this carbon monoxide atmosphere, causing an increase in his red blood cells to compensate for his inability to carry oxygen, and that was why he clotted off. And we wouldn't have had that if it hadn't been for that student sitting down and taking the world's most in-depth history from this patient, because we couldn't work out what was going on. And that really highlights one of the things we say to the medical students in the first year when they're grinding their teeth and saying, we're asking questions, we're doing these histories, when do we get to examine the patients? 80 to 90% of your history comes from talking to the patient, asking about their symptoms, finding out how the symptoms have developed and changed. You know, 20%, 10% of your diagnosis is only going to come from your examination. And the vast majority of the time, your examination is merely there to confirm or refute the differentials that you've come up with from the history. So yeah, that was probably my best ever case to be associated with. Abbie, what are your hobbies outside medicine?
So I don't have a huge amount of hobbies outside medicine. I got the work-life balance very, very wrong. But I do a lot of blogging, and it's been something I've done since first year. So every single week at medical school I've blogged. I like reading, which is a really stereotypical thing, and I've got into a lot of crafting recently. So I do a lot of crocheting and a lot of Netflix watching, which is very therapeutic.
And what are you watching on Netflix?
The same 3 programs over and over again. So Big Bang Theory, The Office, the American version, which I love to bits, and I'm just starting to get into Stranger Things. I watched the first episode the other day, and yeah, it's pretty good.
So Jake Dawkins has said, can you describe what you took from the experience of being on the island? Well, we do have a video talking about some of the medical things from the island, but personally, the real learning thing for me was that you have to be yourself, and if you try to be something that you think other people will want you to be, it's going to be time consuming and it will eat you up, and you won't be happy with that. Being on the island helped me to come to terms with being me and understanding my own brain and how it works, and accepting that actually you can't have everybody loving you, and if you try to keep everybody happy, you probably will just be an unhappy person yourself because you're not being true to you. Now, the island for me was 4 or 5 years ago now, and I've missed that adventure. Yeah, I did Everest Base Camp just before lockdown, but then subsequently I've felt I've had itchy feet, and I'm very lucky that in the not too distant future I will be going back on expeditions, as it will, to the jungle. But I'll hopefully be taking a couple of cameras to be talking about maybe, expedition medicine, things that we might do out there in the jungle, and perhaps hopefully talk a little bit about what we encounter out there. It's very much a question mark at the moment, what's going to be possible, but you never know. There may be a few extra videos coming your way from that shortly. Okay, I think that's enough from me. Let's get another video over from Abbie, shall we? Do you have any career advice for people who might be on the spectrum like yourself?
So I'm career advice for medical people on the spectrum. From the medical point of view, it's just to kind of go at it and challenge yourself to new things. We have things that will take us longer to learn, so communication wise, but actually I think it's a really good career for people on the spectrum. A lot of our conversations with patients are scripted, so you know exactly what you're going to say, and it's actually a lot easier talking to them. So it's just kind of making sure you're being yourself, and when I started realising that, that actually led to the best exam results I've ever had at medical school, when I just realised that I'm going to do it my way, and it's slightly different to the rest, but it's still correct, still safe, and I'm enjoying myself a lot more.
Operatico asks the eternal question, when will I as a medical student stop feeling like an imposter? Honestly, I don't know. The number of times that a patient will ask you a question and you don't know the answer, and you start, beating yourself up inside your head and just thinking, why am I here? I'm still expecting someone to call me and say, yes, I know that you graduated 12 years ago, but there was a mistake on the finals exams, and actually you're not a proper doctor. I think that imposter syndrome tends to be more strongly felt when we're with our peers, because they always seem to know more than us and be more skilled or better equipped at dealing with their patients, whatever it is. So imposter syndrome is, I think, part of being a medic. Even those people who I look up to and admire, they seem to comment a bit similarly as well. So it's just life really, I'm afraid. If you're happy, is there a challenge you've had that you'd happily tell people about and how you overcame it? Don't worry if not.
Yeah, so one of the big challenges that I do have is communicating with staff on the wards, so more my peers sort of thing. I think it's because there's less of the clear relationship boundaries there, and we don't have the scripted conversations as we do with patients. So I've had to learn a lot from my clinical partner, and I've recently just learned it's about confidence and being open and being polite. I'm now not afraid to ask people to repeat things or explain things in a different way, because at the end of the day, it's my patients that are going to be at the end of my kind of processes and what I do, and I want to make sure I get that right, so I'm apologetic for asking for what I need.
Creso Better Orionis asks, now this is an interesting one. I think this is a good question. Why are you really doing this? I mean, the medical issue is no more in your focus. I'm not quite sure if I understand quite how you mean that the medical issue is not in my focus. That's definitely not the case. I mean, I'm in the process of doing another anatomy video for the shoulder, which has taken me 5 weeks to write the thing, just because it has to be right. We've split the examinations into the demonstration, which is really useful for students to watch and watch and watch, because they can learn the movements then, against the deep dives where we're talking about what it is that we're doing at each step, giving them more academic learning, and from what I understand, people are also gaining a benefit from that. So I would disagree there and say that the medicine isn't my focus. As to why I'm doing this, honestly, I enjoy it. Medicine is cool. Medicine is what I do. It's fun. And the more that I do this, the greater the chance that it maybe helps an extra student who's struggling with concepts. There are so many things that were so difficult for me to grasp at medical school. And one day somebody would say something in a slightly different way and suddenly it would click. And I'm hoping that the weird way that my brain works, the ways that I remember things, etc., hopefully it will help somebody else's brain to click and remember a fact. And with that, I'm a very visual learner. I don't learn well from textbooks, so I wish that I'd had videos like as are available on YouTube from many of the other doctors and many specialties when I was learning medicine. That's why I'm doing this. I do a few other things like this and some of the readings, partially because I enjoy doing those. The 3 Men in a Boat were for my cousin, not my cousin, my nephew. Similarly, I've got the Winnie the Pooh book, which I'm going to try and do, and at the end of the day, I suppose part of it is not that much different from painting Warhammer models for me. It's another form of creativity, and that's the big thing that I'm aware of as a medic. I never feel that I build something. I help somebody, we maybe tweak something, and that's them gone. I'll never see them again potentially, or maybe not see them again for a couple of years. So I'm all the while doing a little thing, but planting seeds, if you will, but I rarely see them grow. And that's why it's meant so much to me to see this community here grow, because it's something that's being built, and that's gratifying for me. So I hope that explains why we're doing these videos. So Joseph and Guyan asks, I want to know how often you drink tea and how often you wear a suit. Not as often as I'd like. I'm one of those weird British that doesn't drink tea. I'm not a fan of hot drinks at all. I'll do a Lipton iced tea, but tea just doesn't do much for me. And that's for how often do I wear a suit? Really, not enough. I've just been and had my suit fitted for my wedding, which I'm quite looking forward to. But now we're sort of living post-COVID, as it were. The vast majority of the time, I'm wearing scrubs. I'll wear real clothes when I go to teach at the medical school, but no, I kind of miss wearing proper clothes. Elliot Mellows asked, can we see your 100k plaque? Well, here's the actual thing. So you get this. I tell you what, we'll have a look at what this is in a minute. I'll go next door and we'll reset the cameras because, well, I'm impressed with it, and maybe you guys haven't seen them yet. Well, here we are. This is the YouTube plaque. So, you get this thing through the post, and well, it's. I'll show you. Simply, I think it's one of those things that it's better seen rather than told. So inside you get a nice letter from YouTube. Some 100,000 subscribers. Just how far have you come? If each of your subscribers were a light year, they could take you from one side of the Milky Way to the other. That's far. And that's why today we're so excited to celebrate your special YouTube journey with you. Not only have you brought a unique voice and style to the world, but you've also created valuable connections and built a community along the way. Honestly, we have. I'm really, really grateful for this little community we've got here. There's names that I recognise, and I have an understanding of some of the things that you've said, and family members and things that you're going through. So thank you for that. Thank you for joining us on this journey. In that spirit, YouTube is proud to present you with this Silver Creator Award, which celebrates your hard work and an incredible achievement. Congratulations on this amazing milestone, just one of the many we hope will follow in the future. After all, there are countless others out there who've yet to discover your passion and dedication. Whether they come to your channel to learn something new or just for a laugh, a whole new audience is waiting for you to inspire them, just as your growing community continues to inspire you. We can't wait to see what you do next, and we'll be with you every step of the way. Yours sincerely, CEO of YouTube. So that's the cover, and then it's under here. There we go. Dr. James Gill, 100,000 subscribers. I still haven't worked out whereabouts I'm going to put the thing. My office is a mess, which is why I don't film up there. But yes, I'll probably find a space on a wall up there. So yeah, thank you for everybody who's helped us get to that level, and also thank you for the encouragement to keep doing these videos. I've done them to try and help people, and some of the comments that people have put, they've been really inspired me to keep going. So thank you. Speaking of keep going, let's go back to a few of those questions, shall we? So, well, that's what the YouTube plaque looks like. Thank you to all of you for helping me get there. I have seen, there's one chap's left 3 questions, which I think might be useful. So, Stephman1993 has asked, how much actual need is there for donating blood and plasma? Oh, hello. I thought it was too hot for you. Apparently not. But you're going to have to move slightly because I need to see the iPad. Come on, sit down. Sit down. You must excuse our feline friend. Come on, sit down. Sit down. Thank you. So Stephman1993 asked, how much actual need is there for donating blood and/or plasma? And should I do it? Will it really make a difference? Is my blood really even needed? Will it benefit the doctors, and/or will it just be sold to the highest bidder instead, as claimed by various internet sites and blogs? Is it dangerous or unhealthy for me to donate blood as a 20-year-old male? Well, to be fair, I think that's probably a good series of questions to finish on. Let's try and break that one down, shall we? How much actual need is there for donating blood and/or blood plasma? I'm sure people are aware that you'll see adverts on buses and on billboards in the UK to donate blood. That's relatively routine because we want to encourage people to donate. However, the nature of the advert that you're seeing gives you an idea of how important it is or how acute our blood shortages are. So, for example, we've got the TV adverts, we've got the radio adverts, we've got letters through the door, and then we've got the telephone calls that go out on a blood drive to people who've previously donated. By the time you're getting text messages and telephone calls asking you to donate, we're down to about 24 hours or less of blood stocks remaining in your area or in the country. So yes, it is very important if you're able to try to donate based upon the requests. It is certainly needed, and yes, it's going to make a difference. You sometimes see on the motorway, motorcycle couriers with all the high-vis blood transit signs on them. That will literally be somebody who has potentially a rare blood type having what could be one of 10 maybe units of blood in that area transported from one hospital to another. Now, I'm one of those individuals. I'm B rhesus negative, so I've only got 2% of the population has the same blood type with me. B rhesus negative means I can only have B rhesus negative blood, or I can have O negative blood. So I'm quite limited in who I can have blood from. So there's going to be less of my type of blood available in the stocks, as it were, compared to O negative, for example, which they're going to keep much more of, or try to, because that's a universal donor blood. Anybody could have that. So yes, it's always worthwhile to donate, and that can also enable you to find out what your blood type is, such as that's how I found mine out. Will it benefit the doctors? Well, honestly, it's not really going to benefit us because we're not vampires. We don't need the blood, but we need it for the patients. And there is nothing worse than not being able to provide the patient with their type of blood and having to use a different form, such as myself, B rhesus negative, taking O negative blood. Because there are many, many factors in the body which determine compatibility of blood. It's just that the ABO and the rhesus factors are the commonest ones. Sometimes we have to cross-match blood even more tightly than just those antigens. And again, we will pay attention to the blood that comes into donation, and we'll make sure that we're able to cross-match more closely. And everybody thinks about blood from the perspective of car accidents and major trauma, but actually we need the blood for operations as well. And sometimes an operation won't be able to go ahead until we have sufficient stores of a patient's blood, because they're going to be likely losing it. So for example, we're going to want to have group and save and cross-match blood for most major surgeries, particularly anything like vascular, for example. Is it sold to the highest bidder instead of claimed by the various internet sites and blogs? Components of the blood can be sold, yes, but the majority of it is put into patients that need it. And when I say components, there's more than just red blood cells in blood, but for the vast majority of patients, that is what we'll be needing. When we say, get this patient a unit of blood, we're not giving them a unit of the stuff that's come out of somebody's arm. We're giving them a unit of packed red blood cells. So we've taken everything out and it is just the blood cells in there. And that's because we can do more with the blood that way. We'll separate the blood into the platelets, into the albumin, into the red blood cells, as I say. All the immunoglobulins can also come out, and medicine is expensive. If we can find ways of selling or using in research, and that's probably more likely, components of the blood that we're not going to use because of their shelf life, then it's much better that that happens than it's wasted. And honestly, I don't think anybody would object to blood that they've donated, rather than being wasted, being put into research, for example, because it's not being used. And we use much less albumin, much less immunoglobulins than we do the straightforward red blood cells. Actually, just to clarify that, I'm pretty confident that some of those components, such as I think immunoglobulins, have to be donated in a different way. So you specifically have to say, I wish to donate that. So that wouldn't come off the red blood, wouldn't be taken out of regular blood. Now, what was the other point there? And is it dangerous or unhealthy for me to donate blood as a 20-year-old normal male? Absolutely not. There's minimal risk. You're going to have the risk associated with, just a needle stick, as it were. Apart from that, definitely go for it. Okay, I think we'll leave that there. Obviously, thank you for helping us get to the 125,000 subscribers now. I hope that the channel is, helping you for whatever reason it is that you come here. Again, thank you for the support you've given Abbie. I know that she's enjoyed the comments and things that yourselves have put there. So thank you for the joy that I've seen that you've brought to somebody else. Keep safe, and yeah, I'll see you in the next one. Cheerio.